Hi everybody, my name is Guillermo Coronel, and today we are going to talk about Eltrombopag before procedures in patients with cirrhosis and thrombocytopenia. Eltrombopag is an oral thrombopoietin receptor agonist approved for use in patients with chronic immune thrombocytopenia. A phase 2 study showed that Eltrombopag could increase platelet counts in patients with thrombocytopenia and hepatitis C. Thrombocytopenia is frequently observed in patients with chronic liver disease, with studies suggesting that it occurs in up to 76% of patients with cirrhosis. The degree of thrombocytopenia is proportional to the severity of the liver disease. Thrombocytopenia increases the risk of bleeding during and after invasive procedures, and may result in the cancellation or postponement of elective procedures.
Blood cells are produced in the bone marrow. The three main components of blood are red blood cells, which carry oxygen, white blood cells, or leukocytes, which fight infection, and platelets, also called thrombocytes, which assist in the formation of blood clots. When a blood vessel is damaged, platelets adhere to the surface of the damaged vessel and release chemicals. These chemicals attract more platelets as well as red blood cells in order to form a clot or thrombus. As the clot grows, the blood vessel narrows, thereby decreasing blood loss. This process is called coagulation. Normal platelet counts are in the range of 150,000 to 350,000 platelets per microliter. Thrombocytopenia is a disorder in which there are not enough platelets. When the platelet count is decreased, the body is unable to form blood clots, and therefore is unable to control bleeding. Bruising and bleeding can occur from relatively little trauma. When the platelet count gets below 10,000 platelets per microliter, bleeding can develop without trauma. Chemotherapy-induced thrombocytopenia is a disorder that develops as an adverse effect of chemotherapy. Cancer drugs not only kill cancer cells, they can also damage the platelet-forming cells in the bone marrow. The severity of this disorder depends on the type of chemotherapy and the duration of treatment. Fortunately, chemotherapy-induced thrombocytopenia.
Well, as we can see, platelet transfusions are commonly used to reduce the risk of bleeding during a procedure, but their short duration of efficacy and the risk of transfusion reactions limit their use. Furthermore, the development of antiplatelet antibodies can cause refractory thrombocytopenia in up to half of patients who receive multiple transfusions.
But John, you're working with a very interesting new drug for immune thrombocytopenia. Tell me what the challenges were that you took on.
The main challenges were that what we're looking at is immune thrombocytopenia in children who the disease has been going on for a long period of time and are having clinically significant bleeding. So we are only talking about a very small proportion of children. So the difficulty was really getting a large enough cohort of children together to be able to run the study.
Now, for adults, the problem's already sorted, is it?
So for adults, Eltrombopag has already been tested and has been licensed and is approved for adults who have either got ongoing disease after splenectomy or are unable to go for splenectomy.
Now this is a thrombopoietin mimetic. What is it about it that it's going to do, or hypothesize to do to your children?
So what we hope to see in the children is that the results will be similar.
Treatment with Eltrombopag increases platelet counts in the majority of patients, whereas the counts remain essentially unchanged in the placebo group. The quantity of platinum administered to patients during each transfusion episode was lower in patients receiving Eltrombopag than in those receiving placebo.
From San Francisco, this is Jane McNeil reporting for Elsevier Global Media Hematology. There's encouraging news from management. Platelet counts increased.
So in conclusion, I think top change has probably come to the treatment of ITP. For patients that are refractory to the conventional therapy or suffering from lots of side effects, there is now new hope and a new treatment alternative. Can Eltrombopag effectively raise platelet count in this group of patients? From the raised data, I think the answer is, as President-elect Obama has said, yes, you can. Thank you.
What were you trying to find out in this?
In conclusion, treatment with Eltrombopag at dose of 75 mg once daily for 14 days reduced the need for platelet transfusions in patients with chronic liver disease and thrombocytopenia who were undergoing elective invasive procedures. Platelet counts were increased during treatment with Eltrombopag and for up to weeks after treatment. Thank you very much.